I'm doing med demonstration part 2. The date's February 7th, 2021, and the time is 16:35. I'm going to compare the physician's order to the MAR. We have the patient Jake Nursing, Finn 312, 312, 654, 654, 987, 987, date of birth January 1st, 1960, January 1st, 1960, Dr. Skills Lab, Dr. Skills Lab. The patient has no known allergies, and the physician's order has been transcribed correctly because there's 2 signatures here, 2 signatures here, and on the MAR it's been transcribed correctly. There's 2 signatures here and 2 signatures here. Right medication, ondansetron, right dose, 6 milligrams, 6 milligrams, right route, intramuscular, right time and frequency, daily before supper. It's scheduled for 1700. It's 16:35 on the 7th, and no one's given this medication, so I'm okay to give it. We have right medication, heparin, right dose, 5,000 units, right route, subcut, right time and frequency, daily. It's scheduled for 0800, so I'm not going to be giving this medication. The order also states, admit patient for uncontrolled nausea and emesis secondary to chemotherapy, as well as insert Foley catheter now to monitor fluid balance, ins and outs closely. So I no longer need the physician's order sheet. I can start getting my medications out. So I'll do hand hygiene, pull the medication, and compare it to the MAR to make sure I have the right one. We have ondansetron, which is the right medication. It's calling for 6 milligrams. This is a 2 milligram per milliliter vial, so I'm going to need 3 milliliters of the medication. I'm also going to look to make sure to see if it's expired or not, and it's not expired, so I'm okay to use it. I'm also going to look at the drug monograph for administration and preparation notes. I'm going to see if it's been administered by a nurse or a student nurse, which it can be. I'm also going to check to make sure the dose is within the proper range, which it is. I'm also going to check to see the maximum daily dose, which I can see, as well as if I need to reconstitute or dilute, which I don't have to. I can administer it undiluted. I'm also going to look for any potential hazards listed, as well as any additional notes that I have to be aware of. So now I'm ready to start preparing my medication. So I'll do hand hygiene again, pull a alcohol swab, and I'll clean the top for 30 seconds in a circular motion, and I'm going to let it dry. While I'm letting it dry, I can pull out my syringe. I've chosen a 3 milliliter syringe, as well as a needle. I've chosen a blunt fill needle. So I'll attach the needle, and then since I'm going to be drawing up 3 milliliters of medication, I have to first inject 3 milliliters of air into the vial. And then I'll slowly drop the medication. Okay. And once I've done that, I can reattach the cap using the slip tip method. And then I'll pull back to see if I have any bubbles. I have one there, So I'll tap to get rid of it. And that got rid of it. So I'll pull back to make sure all my medication's in the syringe. And then I can select my insertion needle, which I've chosen a 22 gauge times 1.5 because I've chosen the ventrogluteal intramuscular injection site. So I can switch these out. This would go in the sharps container. And I'll attach the needle. And then I can readjust my medication to ensure that I have the proper dose. And then I can show the camera. Oh, I guess you can't see. There you go. And then I can prepare my medication label. So this is for patient Jake nursing. The drug name, ondansetron. The dose is 6 milligrams. The volume is going to be 3 milliliters. I don't have to dilute it. The concentration is 2 milligrams per milliliter. The date and time, so it's February 7th, 2021, and it's 16:35. And I'll put my signature, KCUMSN2. And then I would attach that onto the cap. Once I'm done that, I can do my second check of my medications. So we have right patient, Jake nursing, Jake nursing. We have right drug or medication, ondansetron, ondansetron, ondansetron. We have right dose, 6 milligrams. This vial is 2 milligrams per milliliter. So to get 6 milligrams, I need 3 milliliters. So I'll do my second check, which is what I have here. Right root, intramuscular. This is an intramuscular medication. I've chosen the right needle and syringe for a ventrogluteal intramuscular injection. Right time and frequency, daily before supper. It's scheduled for 1700. It's 16:35 on the 7th, and no one's administered this medication, so I'm okay to give it. Okay, so I don't need this anymore. It can go back into the medication stockpile. And then I'm ready to go in the patient's room. I'm going to need an alcohol swab, gloves, my drug card, the medication, and a pen. And then I'm ready to go. So I'm going to go into the patient's room, knock on the door, and then I'm going to do my entrance safety check so the patient doesn't appear to be in any distress in terms of their ABCs. Their bed is at the lowest position, their call bell's within reach, there's no hazards or tubes or lines that I need to be aware of. Hi, my name is Katarina Candeias. I'm going to be your student nurse today. I'm going to check your wristband. So we have the right patient, Jake nursing, right fin, 312-312-654-987-987. Can you tell me your name? He says Jake nursing. And your birth date? He says January 1st, 1960. Do you have any allergies? He says no. Okay, great. Okay, Jake, before we get started, I'm going to do my third check of my medications. We have the right patient, Jake nursing, right medication, ondansetron, right dose. We have 6 milligrams, which is 3 milliliters, which is what I have here. Right route, intramuscular. I've chosen the right needle and syringe for a ventrogluteal intramuscular injection. Right time and frequency, daily before supper. It's scheduled for 1700. Currently it's 1635, and no one's given this med, so I'm okay to give it. Okay, after I've done that, before I administer, I'm gonna do hand hygiene and then put on my gloves. Okay, Jake, what I have here is ondansetron. It's an antiemetic. It's a 5-HT3 antagonist, which is going to help with your nausea that you're experiencing because of your chemotherapy. Some side effects that you might experience are headache, dizziness, and fatigue. Would you still like to take this medication? He says yes. I've already assessed his history of hypersensitivity to the drug, as well as if he has any hepatic impairment. I've done a full set of vital signs and a thorough GI assessment. After I'm done that, I can pick the site. I've chosen the ventrogluteal, so on a person. The heel of my hand would be at the greater trochanter. My thumb would be pointing towards the groin, my first finger towards the iliac spine, and my middle towards the iliac crest. And then I would be injecting in the middle. Chosen this site because it's an intramuscular site, as well as it's good for high volume injections. After I'm done that, I will take my alcohol swab and clean the site for 30 seconds, and then I'm going to let it dry. Okay, Jake, this is going to be a needle. And then my site that I'm working at does not require me to aspirate, so I'm not going to do that. So I would pull the cap off, Z-track to the side, inject at a 90-degree angle, stabilize, and then inject the medication slowly. Once that's done, I will take out the needle, release my hand. I would activate the needle, and then I would put it in the sharps container. For now, I'm just going to put the cap on, even though we wouldn't do that in real life. If I had a cotton swab, I would hold it to the site for a few seconds. Once I'm done that, I would take off my gloves, throw them in the garbage, and perform hand hygiene. And then I would sign the MAR. I would sign it at 1635, and my initials KCUMSN2. Once I'm done that, I would do my exit safety check. The patient doesn't appear to be in any distress in terms of their ABCs. The bed's in Lowe's position. The call bell's within reach. There's no hazards or tubes or lines I need to be aware of. Do you need anything before I go, Jake? He says no. And then I would say, okay, I'm going to come back in about a half an hour to assess the therapeutic effect of the medication. Hopefully your nausea will have gone down by then. When I come back, I'm going to do a full set of vital signs and another GI assessment to help me assess the therapeutic effect. And then I would leave the patient's room. After I leave the patient's room, I would document any assessments I did previous to administering the medication.